Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm your host, Steven Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. And well, this week it's been quite a doozy in the healthcare world. There's a lot to discuss and how it relates to public health policy and what it might mean specifically for our community, the chronically ill patients and those dealing with various other ailments and what it might mean. So let's get into it. Last Thursday, HHS Secretary Robert Kennedy announced that they would be laying off 10,000 staffers at Health and Human Services. The Food and Drug Administration will be the hardest hit, accounting for about 35% of that total, followed by the Centers for Disease Control and Prevention, the CDC. Some might recall that RFK is perhaps making good on a promise he made last fall before the election when he told the FDA workers that they should plan to, quote, pack their bags. Well, I guess now's the time to start packing for some of these folks. Now, that being said, even though HHS will be operating with about 3/4 of the people it had before Trump took office, RFK has pledged in a video message that the cuts won't affect crucial services that HHS oversees, like reviewing drugs before they hit the market and responding to disease outbreaks. However, a lot of former HHS leaders dispute that. And when you cut 25% of your workforce, just viscerally, it sounds like it would be difficult to maintain the same level of care. But we shall see. Robert Califf, who led the FDA during the Obama and Biden administrations, has said that his former colleagues at HHS are, quote, demoralized. He said, "I've never seen a group of hardworking people treated so disrespectfully in the workplace." And I have to say, from a distance, on the outside looking in, I understand what he is saying and what folks might be feeling, both those who have been let go from HHS and those who have not been let go but are still there. So we should see. The former chief of the Centers for Medicare and Medicaid Services, Chiquita Brooks-LaSure, who led the agency under the Biden administration, spoke to reporters on Friday. She spoke about some specific areas that she has concerns with. She focused in on nursing home inspections. She said that that is an area that has always been significantly underfunded, and she fears it might get worse with these cuts, of course. She said, I'll use her exact quote, "People are just not appreciating the devastating changes at HHS that have come down the pike this past week with the HHS workforce. It's crucial that the people are able to get the care that they need." So that's what's going on at Health and Human Services, the organization writ large. In one of its sub-agencies, the FDA, last Friday, Peter Marks resigned from his post as the FDA's top vaccine regulator after he was told by Trump administration officials that it was either resign or be fired. He chose to resign. Public health experts and former FDA commissioners have been speaking out and are alarmed by Mr. Marks' ouster, what it portends about containing infectious disease, given that Robert F. Kennedy's anti-vaccine agenda. As part of his resignation, Mr. Marks on Friday night spoke of concerns with the leadership at the FDA and with HHS generally, and their views on vaccines and their skepticism and what it might portend going forward. And he specifically noted some fear with relate in terms of as infections start to rise, particularly in view of what is happening with the measles outbreak in parts of this country. He specifically said it is unconscionable with the measles outbreaks across the United States to not have a full-throated endorsement of measles vaccinations. Speaking of measles, the outbreak in Texas and elsewhere around the country is getting worse. Officials said that they had identified 400 cases as of last Friday, primarily in the western part of the state. That represents a 20% jump from the cases just a few days prior. Outbreaks are also growing in New Mexico, which now has 44 cases, Kansas, which has 23 cases as of Friday, Oklahoma, 9 cases, and Ohio, 10 cases. So we're talking at close to 500 cases, if not more than 500 cases. And this is all coming amongst, as the alarm grows among public health experts over what HHS Secretary RFK's response has been to the outbreak, including his suggestion that things like vitamin A and cod liver oil could be effective treatments for measles. Spoiler alert, they're not. And on top of that, these cuts that we have been describing at HHS have impacted people who track the spread of measles and other infectious diseases, as well as canceled grants that include research on vaccine hesitancy. That being said, as the measles outbreak continues to grow, there has been a growing increase of folks who had previously been anti-vaccine or vaccine skeptical, particularly in these areas where the outbreak has grown. They become very pro-vaccine, let's say. They're starting to rush out to get vaccines, which I guess is a good thing in some respects. And as we have said multiple times on this podcast, the best way to protect yourself when it comes to measles or any of these other infectious diseases that have been nearly eradicated, and heavy emphasis on the word nearly, the best way to protect yourself, of course, is to get yourself vaccinated. And for diseases such as measles, it's really making sure that children that you are around are vaccinated with the MMR vaccine. So that's where we are. Not fun times, to say the least. Lots of cuts at HHS, the departure of a chief vaccine authority at the FDA, and growing measles. I know it's not fun stuff. It's a tough time in public health, as we have talked about on the podcast previously, but we're going to stay on top of everything, as we always do here at the Health Advocates, and we will continue to advocate on behalf of all patients and on behalf of the idea of trusting science and making sure that we continue to expand the profile of our patients and continue to expand the idea that public health is a good thing for the public at large. And that's really all there is to say on that. Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating, write a review, and hit that subscribe button wherever you listen. I'm Steven Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.